Welcome to the Long COVID podcast with me, Jackie Baxter. I am really excited to bring you today's episode. Please do check out the links in the show notes where you can find the podcast website, social media and support group, as well as a link to buy me a coffee if you are able. You should not rely on any medical information contained in this podcast and related materials in making medical, health-related or other decisions. Please do consult a doctor or other health professional. I love to hear from you. If you've got any suggestions or feedback or just want to say hey, then please do get in touch. I really hope you enjoy this episode, so here we go. Hello and welcome to the Long COVID podcast. I'm really excited today to have Kelly Mitchell, the breathing PT. Kelly's been working with lots of people with long COVID, so I think this is going to be really useful. So welcome to the podcast.
Hi, thanks for having me.
So to start with, would you be able to introduce yourself? Just sort of let us know who you are and what you do.
Yeah, for sure. My name's Kelly Mitchell. I'm a specialist respiratory physiotherapist. I qualified as a physio in 2007 and began working in an acute NHS trust in 2008, worked in all sorts of areas across the hospital and eventually specialised in about 2014 in respiratory. And that was where my interest and passion for all things breathing began. And I work with long-term conditions mainly, so cystic fibrosis, bronchiectasis, COPD, that kind of cohort. And as you can imagine, they tend to breathe quite poorly. So my interest in breathing pattern started within that time. And I worked in the trust until 2020. And then I left and I decided to start working for myself. And I now specialise in the treatment of breathing pattern disorder.
Great. Yeah, breathing pattern disorders is something that I had never heard about until very recently. And I suspect I'm probably not alone in that. Could you talk a little bit about what it is and why do you think so many people with long COVID experience this?
Yeah, absolutely. So breathing pattern disorder, in a nutshell, is you are breathing in a way that is not optimal for your body. And as a result of that, you get a range of symptoms from it. The classic one that people probably have heard of is hyperventilation syndrome. So that would be when you breathe at an increased respiratory rate usually, and you overbreathe or you breathe in excess of your body's metabolic demands. And then you have a range of symptoms that follow from that. It's a whole body issue, really. Although it's just your breathing that's at fault, you end up with a whole range of symptoms, and that's similar for long COVID, really. So something would happen to change the way that you breathe, and that trigger or event could be anything. So it can range from an illness, a one-off illness, so COVID, for example. It could be long-term stress, work stress, life stress, home stress. It could be exercise. It could literally be anything that changes your breathing. So anything that would increase your breathing rate could potentially cause you to develop an issue longer term with your breathing pattern. So relating it back to COVID, why do I think so many people with long COVID have breathing pattern issues? Number one, it's the nature of the illness. COVID by default will increase your respiratory rate. Just it's a respiratory illness. Also, it increases your temperature as well in some people. So an increase in body temperature will also cause an increase in respiratory rate. So there's that side of it. There's also the anxiety side of it that goes along with COVID, in that it was a new thing. We didn't know what it was, and people were getting very, very poorly with it. So understandably, the stress and the anxiety of having it would increase your respiratory rate. In some people, not all, but that certainly is a factor. And it's kind of that perfect storm of the nature of the illness would then predispose certain people to develop a breathing pattern issue during and afterwards.
Absolutely, because if your breathing's affected, then you want to get that air in any way you can, don't you? I guess.
Absolutely.
Even if it's really bad.
Yeah, and if your lungs aren't working as effectively because of what is happening inside of you, your body will respond appropriately. And that's the thing, is at the time your body was responding fairly appropriately, but it then continues. And even after this event has passed, the issues then continue. And that really is what the breathing pattern problem is. It doesn't matter that it's gone, the breathing pattern issue has now become a thing of its own.
So it's like that kind of developing a habit thing, isn't it? For whatever reason it's happened, it can be quite hard to get out of, especially if you don't realize you're doing it.
Absolutely. But you end up with physiological and biomechanical changes, so your body then maintains really fragile homeostasis as a result of it. So it's not so much of a habit necessarily, it's that your body is keeping you, so you are actually being kept in that pattern.
It's fascinating, because I'd never really even considered this before. Breathing was just something you did. The fact that you could do it in the wrong way or the right way, or just different ways, was definitely a bit of an eye-opener for me. So how would somebody know that they might have a breathing pattern disorder?
The most common way is symptoms, really. So if we talk about long COVID, if you've been to your GP or you've seen a whole range of specialists and they've done all the tests on you and they're quite happy that there's nothing medically underlying, but you still have shortness of breath, chest pain, chest discomfort, pins and needles in your fingers, toes, around your mouth, dizziness, brain fog, fatigue, post-exertional malaise, those symptoms are potentially being driven by a faulty breathing pattern and the resulting physiology that happens. So it's more to do with the symptoms that you have. The easier group to pick out are those guys that talk about things like, I've got air hunger. So they talk about needing to take big, deep breaths, and this inability to take a satisfying deep breath in, or shortness of breath on minimal exertion, despite being previously fit and well before. They can't catch their breath. They're the guys that are easier to pick up because they're the more common symptoms. But not everybody who has a breathing pattern issue has respiratory symptoms. I've had loads of people say to me, if they reach out on social media, they'll say, my breathing is absolutely fine, I don't have any respiratory symptoms. And I'm like, oh, you might do, you may well actually have an underlying issue. Don't just dismiss it. So it isn't just respiratory symptoms, it's all the other things that go along with it. Fatigue, that can be as a result of how you're breathing. So I always say, if you really want to know that if you've got a breathing pattern issue, you should be assessed by somebody who specializes in that area to make sure that you're getting the right diagnosis. There are simple ways that you can do quick tests on yourself to have a look and just see how you're breathing. You can try and gauge how you're breathing. The issue with doing that is when you bring awareness to your breathing, you naturally change it. And I always say to people, I'm going to look at your breathing, but try not to change it. I know that's impossible, but it is really tough, isn't it? Because as soon as you start thinking about your breathing, either you completely slow it down because that's what you think you should do, or it goes completely. So you don't get a true representation. When I'm assessing somebody, I assess them in a way that they don't know that I'm looking at their breathing. It's the only way to do it, because otherwise you don't get a true representation. But the basics are to look at your respiratory rate and then the pattern of how you're breathing. So how quickly you're breathing and how do you breathe? So are you breathing nicely into your tummy? Are you breathing into your chest using your accessory muscles? Is your breathing even? So does one breath look like the next breath, or is it more erratic? Are there lots of sighs? Are you yawning a lot, doing catch-up breaths, however you want to describe it? Those sorts of things are what you would want to look out for. And if you notice any of those changes, I would certainly be going down the route of trying to get an assessment with somebody who can look at your breathing pattern.
Absolutely, yeah. And the idea that breathing problems can actually have such a wide range of symptoms. It's not just the breathing that it impacts.
Mm-hmm. And one person with a breathing pattern disorder can look very different from somebody else who has the same issue. You might have somebody who has chest pain or shortness of breath, and then somebody else who's got gastro problems or anxiety, and they don't have all the other symptoms. So they almost look like very discrete groups of how they're presenting, but actually they've got the same underlying problem. It's just that they have a different symptom set from it. That's why it's hard to get picked up. So earlier on, you said, I've never heard of it, partly because it doesn't get picked up particularly well. You rock up to your GP, if you read a textbook, all medical textbooks say normal respiratory rate 12 to 20. In the breathing pattern world, we're like, that's hyperventilation. Our respiratory rate should be around 8 to 12 in a normal healthy adult. it's different for children. And if you have an underlying lung condition, you might fall out those parameters. But generally, 8 to 12 is where you should be aiming for. Slow, deep breathing. Deep meaning low, not big volume. So when you go to the GP, even if they took your respiratory rate and it was 17, 18, they'll say, oh, well, it's kind of normal, don't worry about it. But if someone came to my door with a respiratory rate of that, with the symptoms that correlated, I'd think this warrants further investigation. They are likely to be over-breathing or have an issue with their breathing pattern. So we should get that sorted. So it is underdiagnosed from that perspective. And again, when people go to the GP with chest pain, that's a really serious symptom. So what happens is they'll get sent to cardiology, assessed, go through all of the tests and be told, actually, there's nothing wrong with you. You're just anxious. You'll be fine. Off you go. And that was pre-COVID. So this just happens with people who have breathing pattern disorders, not people that have long COVID, even though that is what is happening now with the same group. But it's exactly the same. The underlying issue, there doesn't appear to be anything that's medically underlying. Therefore, they go, oh, well, there's nothing wrong with you. Relax, do some yoga, But actually, what should then happen is, okay, we haven't found a medical cause, but maybe there is an underlying problem here with your breathing, and that is something that we should address and get sorted. It doesn't happen very often. Some GPs are brilliant and they're like really on it, and they know that this exists and they know the impact that it can have, but others, they just don't have the knowledge or awareness of it, which is fine. They can't know everything, but there's certainly many people out there who breathe poorly.
Yeah, and I guess they've maybe got away with it up until now, maybe.
Yeah, I just think it just goes so underdiagnosed.
Sure, yeah, definitely. Are there people who might be more prone to developing breathing pattern disorders?
Absolutely. So what you'll notice is actually the cohort who are more likely to get breathing pattern disorders are actually the guys that are more likely to develop long COVID. I'm not going to talk about any cause or effect here. It's just a really interesting thing. But people who are more likely to have breathing pattern disorders are female. Women, we have a monthly cycle, and every month our progesterone spikes, and progesterone is a respiratory stimulant. So every month we are exposed to breathing more each month. So we are kind of more prone to those problems. So women, asthmatics, so people who have underlying lung conditions are more likely, but the asthmatic group is 40 to 50% more likely to have a breathing pattern disorder, which is quite interesting. People who speak for their jobs, so people who project their voices, teachers, call centre workers. I had an ex-priest come to see me recently, and he was just classic for it. And then when he started to think about it, he was like, oh, some churches are really old, and actually we don't have the mic system, so I would have to project my voice and have all the husky voice that went along with it. So those kind of things. So people that use their voice a lot, they are much more likely to have breathing pattern issues. Athletes, you can really see it in that group because they exercise at high level. So what you'll notice there, it's not unwell groups, it's usually quite fit, healthy people that develop those issues. And with the asthmatic group, it doesn't even have to be really awful asthma that's uncontrolled or they have very, very severe symptoms. It can be in the really well controlled mild group.
That is really interesting, isn't it? Because there's a lot of crossover with the figures of more at risk for long COVID, like you say. I mean, I was wondering about this myself since I've been thinking more about breathing. And I don't know if it's a question that you can actually answer, but do you think a lot of people with long COVID had dysfunctional breathing before they got ill and just didn't notice?
So I can only talk about the people who I've assessed and treated. And when we start to do an assessment, and I do a really in-depth assessment, we go right back, start talking about lots of different things. And it's when we start to go back into their life or the medical history, they're like, oh my goodness, I've been doing this for ages. And I'm like, yeah, you possibly have. The breathing pattern disorder in the long COVID group could have started with COVID. That's enough to be a trigger. So it could have just have been that. But then other people could have been breathing poorly for many, many years before. The classic is, oh yeah, my colleague always used to say to me, you're sighing a lot, are you okay? Because you do that classic and they'd be like, you're doing it loads, are you okay? Probably when they were more stressed. So they were in that, environment at work, a bit more stressed. They'd probably be sighing a lot more than they normally would. And it would present itself in that way. So yes, is what I would say. I can't just put a blanket rule out and say that it is definitely happening with that in everyone. But I do think a lot of people were possibly breathing poorly before. But then that's, a lot of people generally in the population have some element of dysfunctional breathing. So you can be a mouth breather, which is technically dysfunctional. We should all breathe through our nose at rest. And that is a form of dysfunction, but not necessarily had a whole bunch of symptoms set from it. So you wouldn't have necessarily done anything about it. That doesn't mean that later in life you wouldn't have ended up with some symptoms as a result of being a chronic mouth breather. But having the COVID infection and going through all of that has exacerbated the whole thing and made it much more prominent and given you symptoms.
Yeah. So is it really possible to alleviate symptoms by improving how we breathe? We'll be right back. I'm interrupting myself for a second to tell you about long COVID breathing. The fabulous Vicky Jones and I have teamed up to bring you long COVID breathing. We are both passionate about sharing our expertise and experience of the breath and how incredibly helpful that can be with long COVID. We've worked together to develop a course that is specifically tailored to those with long COVID. It's a 6-week course with 12 sessions, all delivered online. The community feel and learning that we're all sharing is such a joy. To find out more information and to sign up for our courses, workshops and other shorter sessions, please check out the link below, longcovidbreathing.com, or email longcovidbreathing@gmail.com to start your breathing journey with us.
Yes. And I think in order to understand how that can happen, we just need to understand what happens to our body from a physiological and biomechanical perspective by changing our breathing. And once you can understand that, you can kind of see how the symptoms would improve as a result. So let's talk about hyperventilation, which is pretty much what most people are doing. Recently, there's a paper that's kind of just come out. It's kind of like pre-release, but in their study they found that 74% of long COVID people had a low end tidal CO2. That's indicative of poor breathing or over breathing. I mean, that's quite a high number. So I'm going to talk about hyperventilation mostly. So over breathing. When we breathe in oxygen and we breathe out carbon dioxide. Everyone thinks of carbon dioxide as a waste gas, but actually it's really important in the function of us as human beings. So we actually need CO2, okay? So when you breathe in and then out, say you should be doing it at 10 breaths per minute, keep it round numbers, but if you're breathing at around 20 breaths per minute, you are breathing twice as much as you should be. So it's not so much about needing to get oxygen in. You know, everyone's put those SATs probes on, and I can tell you now, everyone's pretty much like, yeah, my SATs are always fine. If anything, they're 99, 100%. So we're well saturated. But the problem is that we're actually breathing out twice as much as we should do. So what happens is we end up lowering our carbon dioxide levels. This is where part of the issue comes in. So this level almost becomes reset in our body. So we have a lower carbon dioxide level, and our body resets it. Carbon dioxide is an acid, okay? So it's acidic in nature. Our bodies are a very careful balance of acid and alkaline, which maintains our body pH, and our pH should be between 7.35 and 7.45. So going back to school, chemistry lessons, 7 is neutral. And so we sit just a tiny little bit on the alkaline side of that as normal for functioning healthily, okay? If you get rid of acid, so less CO2, your body actually becomes a little bit more alkaline, and it doesn't like staying there. You'll get a range of symptoms of anxiety, being on edge, hypervigilance from that alone. So your body thinks, oh, we need to get rid of something else that's alkaline within us to balance the scales. That alkaline substance is excreted by the kidneys, and it's called bicarbonate. And that bicarbonate is actually really quite important in terms of exercise. So when we exercise, we produce lactic acid, and bicarbonate would effectively mop it up. If we have depleted bicarbonate, we are not as effective as removing that lactic acid from our muscles. So when we start to think about symptoms such as post-exertional malaise or heavy legs and those sorts of things, we need to kind of think about, why is that happening physiologically? Is that happening in every single person with long COVID? No. But, you know, if you are hyperventilating, it's highly likely that that is playing a part in that symptom. So that's partly what happens. And also when you have a depleted bicarbonate like that, your electrolytes can become disturbed, magnesium, calcium, potassium, muscle tremors, fasciculations, so those sorts of weird muscle cramping, those symptoms that can come from that. CO2 acts upon your vascular tone, so it acts upon your vessels. When you're low in CO2, we vasoconstrict, which means our blood vessels get quite narrow, so then we have reduced blood flow, especially periphery. So people talk about cold hands and feet, that tends to be you're nodding knowingly. Those sorts of symptoms can come from that, but also you're vasoconstricting in your brain, so actually you have reduced blood flow to your brain when you hyperventilate, and that can explain why people may be feeling a little bit brain foggy, because we don't have the blood flow to that area. And we use hyperventilation in medicine. So if somebody was to come into A&E with a head injury who required ventilation as part of their treatment, they would commonly hyperventilate them on the ventilator to reduce their CO2, because we know that there will be an element of vasoconstriction in the brain, which would then help manage some of that swelling. So it's used as a treatment tool in some ways, but that's the effect that it has. Like, it's quite significant, and people are walking around in this state. The other thing that happens with CO2 is it is used to help transport oxygen out of the tissue. So when you have a low CO2, what happens is your hemoglobin, which is what carries your oxygen around your body in the red blood cells, so it spins around your body. And when you have a low CO2, your hemoglobin actually has a higher affinity for oxygen. So what that means is it holds on to it rather than dumping it readily at the tissue. So you then end up with less oxygen being delivered to your cells. You know, oxygen to your cells is where your energy is made, and, you know, they're your powerhouses. And if they're not being powered, you feel quite fatigued, you know, and that's where those kind of symptoms come from. And low CO2 and all of the things that happen, pins and needles, numbness, and all of the reasons that we've spoken about, and that's where those symptoms come from. So how we then treat those symptoms from changing your breathing is you rehabilitate back to normal breathing, the physiology restores to normal, and then the things that are happening from a low CO2 slowly go away. So therefore you end up with the symptom improvement, and that's how it happens. But it's because breathing has an overall systemic effect. And that's the thing that people find really hard to get their head around, I think, because they just think, oh, breathing's breathing. I remember I was talking to somebody on Twitter, and I'd commented on a thread like you do, and somebody said, I know that breathing can be used to try and calm the nervous system down from sympathetic to parasympathetic nervous system, and I know that it's used there, but it can't possibly be a treatment for X, Y, and Z. And I was like, oh no, it can, you know, it really, really can. So then you end up trying to explain that really complicated thing over Twitter with like X amount of characters. And you're like, it's really hard to get your point across. I think that's, yeah, it's another reason it gets lost. It's hard to get your point across with that, because it is quite complicated. But if you understand what happens physiologically, you really can see, yes, you can have chest pain, you can have palpitation, you know, all of those things. It can be because of how you're breathing.
Yeah, it's amazing when you explain it like that, it makes it more clear how it is all completely interconnected. Where I think, yeah, again, like myself, and I'm sure lots of other people had just never really thought about it before. But it's quite obvious when you put it like that.
It is when you know, I think, but the general public, as you pointed out, most people just think you just breathe in and out, you don't even think about it, and you're alive, so it's working, like you're doing it okay, and that's all you need to worry about it. But people don't come to my door until they've got significant symptoms. I wish in an ideal world everyone was taught how to breathe well from school. Like, it should be like this thing that everybody knows that actually this is really good breathing. And most of my clients are just like, oh my goodness, if only I'd known that. If you see your child mouth breathing, you know, I'd be like, you need to start closing your mouth. But, you know, parents don't think about that, because why would you? You just don't see it as an issue.
No, exactly. It's just not something we think about. I mean, I notice it in people all the time now. I keep telling my partner that he's mouth breathing, and he tells me to shut up.
Is he? Oh no, it's the worst. Make him stop.
I know. You mentioned nose breathing earlier. I mean, I'm sure, you know, advice and treatment will obviously vary person to person. Mm-hmm. But is there any kind of basic advice that you can give to people just to kind of get them started?
Absolutely. Number one is breathe through your nose. Your nose is really cool, and it's designed for breathing. Your mouth isn't. It's a great backup. We need it at times, especially during higher level exercise. But your nose is actually what is designed to breathe. So your nose will heat the air, clean the air, wet the air. Really important. That's how your lungs like it. They don't like dry, cold, dirty air, which is kind of what happens when it goes through your mouth, because it doesn't have the capabilities to do those functions. I won't go into the ins and outs of the anatomy of your nose, but it's designed and built for those purposes. The other thing the nose does is it releases nitric oxide, which is a really cool gas, which opens up blood vessels and airways and gets everything nice and open. And if you bypass that, you don't have the benefit of the nitric oxide. So that's really, really important to make sure that you are nose breathing. The other thing nitric oxide does is sterilizes the air. So really important, first line of defense against anything nasty in the air. So super important to breathe through your nose. So yeah, absolutely, nose breathing. Most people, if they are habitual mouth breathers, they will just say, I'm suffocating if I breathe through my nose. It feels really tight. It's really uncomfortable. I can't do it. What I would say is you need to make sure your nose is patent. So most people, actually, when I assess them, when they say that to me, their nose is completely fine. It's just that the nose puts on resistance to the air much more than the mouth. So it will feel tighter and more uncomfortable. It's just something that you have to get used to. So in terms of how do you then re-establish nose breathing if your nose is completely okay, is you just practice. So you would do that in a relaxed, calm way, whether that be lying down on your sofa completely chilled, and you just take one nose breath in and out. And if you can do one, do two. And if you can do two, do three. If after that you feel like, oh, I need more air, then just flip back to mouth breathing. You just slowly start to desensitize yourself to it and just keep trying to increase it slowly. The other group of people they might be a bit bunged up in their nose, a bit sinusy, over the counter stuff, sinus rinsing, steam inhalation, that may well work quite well for those people, so they can just do some home remedy things themselves. They might need to go to the GP for certain medications. The one thing I would say is anything over the counter, just be a bit mindful of it. They are only designed for very short-term use, usually less than a week. You can get rebound effects if you keep using over-the-counter medication for your nose like that. So you can actually make it worse. So make sure you're not using them too long as directed by the pharmacist and your doctor, but try not to use them for more than necessary. And then there's guys who have got actual anatomical problems with their nose and they can't breathe through their nose. So if that's the case, you need to see an ENT doctor because you may well need a bit of surgery. The thing with the nose is because people can breathe, they just think, oh, well, I won't get it sorted, especially now. Everyone's so busy. Nobody cares about the fact that I can't breathe through my nose. But actually, it's really important and you should get it looked at. I always say, if you were to go blind, you would pretty much go to the doctor straight away, wouldn't you? If you can't breathe through your nose, you are losing the ability to use that organ, which is really important. So you should get it looked at and sorted if necessary. But that is a very small amount of people. Most people fall into that first camp of it's just uncomfortable. So yeah, nose breathing, really, really important thing to establish. If you can do nothing else, just breathe through your nose would be what I would suggest. But yeah, that is definitely the first line. The second thing is to think about your respiratory rate. So a normal respiratory rate, as we said, is around 8 to 12 breaths per minute. If you've got a problem with your breathing pattern, you may struggle to pull back rate. So people use different breathing programs and apps, and what they find is that they become very air hungry when they try to pull back their rate, but that's because their body wants them to breathe more and they're saying, no, we're going to breathe less, and they get into a bit of a battle with it. If you're in that boat, you need somebody to guide you through it, more than likely, so that somebody needs to be rehabilitated from your breathing perspective. But yeah, getting your rate down, so breathing nice and slowly. And then the third thing really is to breathe into your tummy. We might have heard it, abdominal breathing, tummy breathing, diaphragmatic breathing. So breathing low into your tummy. So at rest, we should not be using our chest at all. We don't need it. Our accessory muscles, so muscles in our neck and our upper back and our chest, they'll elevate the rib cage rather than breathing low down into your tummy. So when you're at rest, you shouldn't have any movement from up here at all. So to assess yourself, get in front of a mirror, put one hand onto your chest and one hand onto your tummy, and just have a look and see what's moving. And if you have upper chest elevation rather than low down tummy movement, chances are, you know, you're an apical breather, and that is a form of dysfunction. So yeah, you need to get it sorted. What a lot of people do is they do breathing exercises in lying, because they're usually doing it as part of a relaxation session. It's much easier to breathe into your tummy in lying. So people think, oh, I'm an abdominal breather. But actually, when you get up, when you move, when you walk, when you speak, what are you doing? And that's where a lot of people aren't quite as aware of how they're breathing.
That's a really good point, actually, because I think it was when we had a chat a few weeks ago, and I think you took like 2 seconds, you looked at me and you said that I wasn't breathing enough into my diaphragm, I guess. And since then, I've been thinking about it all the time. So when I'm lying down, I'm pretty good at it now. And when I'm walking around, I'm pretty good at it, because that's kind of what I'm thinking about it. When I'm sitting on a chair, I've noticed that I find it really hard to do it. And because when I'm sitting on a chair, I'm doing something else. So I'm not thinking about it. So it's actually quite interesting, but work in progress.
And everyone is. And fixing your breathing is not it's not a quick fix. It takes constant awareness and perseverance and time and you know, keep going and keep going. There's different time frames. We say it takes around 6 to 8 weeks to rehabilitate a breathing pattern minimum. And then there's another saying in the breathing pattern world that for every year you've been breathing poorly, it takes a month to undo it. And some people are like, I've been doing this for 30 years. And I'm like, it probably won't take 30 months, but it gives you an idea that actually it's not something that can be quick. That doesn't mean you're going to be living with these symptoms for a really long time. It just means that in order to keep going and perfect, it can take a little while to get on top of fully.
Yeah, absolutely. I think we always want a quick fix, don't we? It's something that you have to work at. I quite like it when someone says you've got to work at it, because it gives me something to get stuck into.
Absolutely.
I think we all like to sort of press a button and everything be better.
Or take a pill, or just anything that's just easy. But that is human beings. We always look for the easy way out sometimes. And, you know, when it comes to diet and exercise, we all know what to do. It's just actually getting down and doing it. It's the same thing.
Yeah, that's very true. So the fight or flight response, I think we mentioned that a little bit earlier. And obviously quite a lot of things trigger this. I think you mentioned exercise and things, but the breathing, that has an impact on the fight and flight as well.
Yeah, so if we're breathing poorly, it affects our cognitive state. So if we're hyperventilating, breathing poorly, our body is in a state of stress. We are more sympathetically dominated. So our autonomic nervous system, if we look at it from the sympathetic branch and the parasympathetic branch, sympathetic is the revenue up, increased heart rate, you know, sweaty palms, increased breathing rate, you know, pre-interview, that feeling, that will be your sympathetic fight or flight nervous system in control. Whereas your parasympathetic or rest and digest is that calming, you know, it's putting the brakes onto that. So it's, you know, you're nice and calm, relaxed, we're in a good place. As functioning healthy human beings, we should flip between the two. You know, it's not bad to be in a sympathetic dominant state. We need to be there, because otherwise we wouldn't really function. We'd have no need to get up and do anything. You know, it's okay to have stress and live with stress. We need it. But the important thing is that we can then access the parasympathetic nervous system and calm everything down. So we have the balance. That's the important part. When you're breathing poorly, you're basically telling your body in really simple terms, we're in danger, you know, things aren't right, we're breathing like we're running and we're not going anywhere. We've created all of this disturbance in our body, and our body's in a state of stress. And in terms of how that affects you from a psychological perspective, is we tend to default back to those more emotional, responsive type of brain, because when we're in that state, we don't access our nice, calm, cognitive brain. You know, just think about being in an argument. How do you react? You just fly off the handle, and you know that isn't really what you think or feel, or you might burst into tears or just be enraged. You know, your emotional side is coming out. And then an hour later, when you've calmed down a little bit, you're calmer, your rational brain comes back in, and it was like, oh, well, that was a mistake, wasn't it? And it's true, isn't it? But that's a really basic example, but that's how it does affect us. And if we are in a state of sympathetic dominance, so we are over in that zone way more than we should be, we have those psychological stuff going on as well. So it's kind of like this whole body experience. again, going back to the symptoms, a lot of the symptoms from long COVID can be part of that sympathetic fight or flight dominance, and that it's almost like the nervous system has, short-circuited in a way. It's just not functioning as well as it should do. I read a paper that came out, somebody'd written that every symptom of long COVID could potentially be put down to an autonomic nervous system issue. I really do sit on board with that. I do think that a lot of it is a nervous system issue. Again, not in all people. And I just think it's really important to mention here that I don't think long COVID is one thing. And that's why I'm always a bit hesitant to say, oh, yeah, this. I just don't think it is one thing. People do have underlying organ damage or issues with their vasculature or stuff going on. There is definitely that. Then there are definitely people who just have breathing pattern disorder. They are some of the group. Then there are people who have completely short-circuited their nervous system and it is just not working particularly well, and people have to go back and rebuild that whole thing. There's so many different things going on with it, but I definitely think that autonomic nervous system is playing a huge part in a lot of people's presentation and then ongoing symptoms.
Definitely. So obviously the breathing will help with trying to calm that nervous system down. Is there anything else that you can suggest that might help as well and that people can look into? We'll be right back. Hey there, I'm just jumping in for a second to see if you're enjoying this episode. If you're finding it useful, maybe you would consider sharing it somewhere, a friend, a group, or even on your Twitter feed. If everyone was able to share just once, we'd be able to get this information out to even more people who really, really need it. So please consider sharing somewhere if you possibly can. I hope you enjoy the episode, and thank you so much.
They're all the classics, aren't they? So breathing to me is the foundation. If you don't breathe well, you don't feel well physically or emotionally. So I just think if you get your breathing right, it's a really good foundation. Like that has to be right. And then all of the other stuff is exactly what all the long COVID cohort are doing, trying to get adequate rest, good hydration, eating well, supplementation if required. There's other things that you can do to stimulate your vagal nerve. So some people are doing like cold water immersion, and some people are finding that really, really helpful. But those sorts of things are what I would recommend. So I don't think any of that is out of the ordinary or, we've never heard of it before, but I just think it's about having really good routines. So if your sleep is disturbed, making sure that you've got good sleep hygiene routines and all of those things that go along with that. And it's really basic stuff, isn't it? All of that, get outside, get some sunlight, just basic feel good stuff. But in terms of trying to get your nervous system back to normal, that's really, really important. And do you know what? Being a normal person again, many people have been so affected that they aren't socializing in a way that they normally would. They're not having normal social human contact that they would. Just even all of that, it impacts you so much, especially like your emotional well-being. Being outside in nature, if I walk every day because I've got a dog, and if I didn't get out every day like that, that would really affect me. And it's those sorts of things, isn't it? So trying to be able to get them in within the constraints of what is currently going on with you. So if you are able to get in a car and someone can drive you to somewhere and you can sit and, chill if you like being outside, brilliant. Don't go on a 5-mile walk if that's what you used to. You kind of just have to try and adapt what you used to do, but still get the benefit.
Yeah, definitely. Yeah, getting your sort of dose of the mountains by looking at them instead of going up them.
Exactly. Yeah, it's a really good way of looking at it. It's those sorts of things, isn't it? But all of that will affect us.
Yeah, definitely. And kind of jumping onto the relaxation and rest thing, how I get bored when someone tells me to go and rest, and I think, right, I'm going to go and lie on the sofa. And after about 3 minutes, I get bored and think, right, well, I'm going to read a book. But that's not necessarily very helpful, I think, is it?
It depends. So I think there's two ways of looking at it, right? So I think in terms of trying to get you back into a more balanced nervous system and calm everything down, we need to have good quality relaxation or rest, however you want to call it. But if we use the term relaxation, and people tend to confuse that word with downtime, so things such as watching television or doing certain exercises, that would be more downtime. Whereas when we look at rest, what we're really trying to do is, all humans should rest every day in some sort of way. 10 minutes, just unplug from this crazy world that we live in and just have a minute to rest. I obviously use breathing because it's just what I do. You know, it might just be in the bath. So I just in the bath for like 10 minutes and I just focus on my breathing for a little while. So just like nose into my tummy, nice and slowly, nice and calm. Don't think about anything else. Because if I think about my breathing, I don't need to think about anything else. Or I just let my mind wander in a really cool way. That's fine. Then you're talking about relaxation and allowing your body time to just be calm. When you're downtime, people are like, oh yeah, I've watched the telly for hours. And you know, if you think about some of the programs that we watched, we were just talking about Squid Game. I mean, that is stressful. You know, your body is going to be revved up whilst you're watching I mean, I was on the edge of my seat. I just couldn't watch it at times. You know, at not one point during that time was I relaxed. So you know, it depends on, you know, the media that you're taking in and books and, you know, all of that stuff it does have an effect on you. But taking relaxation is about really switching off. And if you're bored, a lot of people who I work with who are pacing and then they do resting, they're like, oh, I do my breathing every time now during my rest, and it gives me something else to do. So they find that quite nice. So they feel like they're doing an activity which is beneficial to them, other than just kind of just lying there and just getting frustrated that that's what they're doing.
Yeah, definitely. Because I find that my brain is very difficult to switch off. It's always thinking something. So I, even when I try to relax, it's pinging all over the place, thinking, oh, what am I having for dinner? And, you know, all of these things that I don't need to be thinking about, but I still am, and I can't turn it off. Whereas as soon as you sort of have something to focus on, like breathing, it sort of focuses your mind, hopefully, I guess, enough, but without it being stressful. Maybe. Is that the point? Yeah.
And I kind of always say to people that people try to push out intrusive thoughts. And so when they do meditations or something, they're like, oh, I'm not meant to be thinking. So they try and push stuff out. The more you do that, the more stressed that you get. And the more you just think, oh God, I wish this was over. But actually with breathing, if you're just thinking about in, out, or you're counting your breath or whatever, it's enough to have that thought in your mind that actually more thoughts can't jump on top as easily. So it's quite nice. It's a really easy way to do it. Just shut off for a little while.
Yeah. It's just sort of simplifying life, isn't it, almost?
Yeah, basics.
Yeah, pretty much. Yeah. So, I mean, talking about the fight or flight, we're talking about how sort of exercise triggers it as well as other things. And I was wondering, does that include gentle exercise, you know, things like yoga or a very short stroll? Because then you've got your mental health benefits of it as well. And how does that kind of balance up?
Yeah, so if you look at it really simply, if anything that you do that increases your heart rate, it's your autonomic nervous system that's increasing your heart rate appropriately. The thing with COVID and long COVID guys are their systems are already stretched. So I'm not going to talk about the guys who got fatigue. So people without, they'll be like, oh, I really want to go for a run or something. And I'm a bit like, oh, I would probably just wait for a little while, especially if they are hyperventilators. We need to get them right physiologically first, because otherwise that's what's causing the issue. But just doing things like, you know, calm, gentle stretches, yogas, it's absolutely fine. And you're right, the mental health benefit is completely outweighs it. It's more the higher intensity stuff, which is where you're going to start to get that real, you know, huge increase in heart rate and blood pressure and respiratory rate and all of those sorts of things. But most people listening will be like, I can't even walk, let alone be even contemplating what you're talking about. So it's completely irrelevant. But when you work at those higher levels, you are actually using that sympathetic nervous system. But that's what it's healthy to. It's just we need to be able to flick between the two. And it's almost like the guys with long COVID are very much stuck over on the wrong side a lot of the time. And it's about trying to just reaccess, being able to go over to that quietening, slowing down side. And that's kind of what the main aim of the game has got to be, really.
I'm thinking, you know, a lot of people are measuring their heart rate and trying to pace using that sort of thing. Is that helpful?
It's really hard. It's, again, blanket rules, isn't it? But yeah, for sure, it is important to do that. And if you are under healthcare professionals that are telling you to do that, then absolutely you should be following that advice, and that's what you should be doing. It's about being able to know when you can start to increase your activity, though. That's kind of the issue, isn't it? And some people, especially that I see, they kind of get a bit stuck with that. So it's about knowing when they can start to push things. But the guys that have got the real dysautonomic heart rate issues, you know, we do not want to be throwing people up into exceptionally high heart rates on minimal exertion and holding them there. Absolutely. That's the group that I would be very, very careful about. But it is normal to have a heart rate increase in people. So if you're not dysautonomic, and you're getting a normal heart rate increase, that's okay. Yeah, do you know what? Interesting. I'm seeing less people with all of those dysautonomic issues than I was at the start. I was just thinking that. I was like, oh, I used to see that all the time. And actually, I'm not getting that group of people through so often anymore.
That's interesting. Yeah.
I don't know why.
You sort of touched on it just then, when people should be starting to increase. And how do you know? How do you know when you can start increasing? And how would you do it? That's probably a really impossible question.
Really impossible question to answer. But what I will say is, with my guys who are definitely have an issue and, they have probably got a problem with their bicarbonate, once we start to normalize things and they can then have a normal response to exercise, what tends to happen is they'll come to me week on, as we go through, and they'll be like, oh, my step count is going up, or I can do X now and I couldn't do that before. And it's this organic kind of growth in the beginning, so this sort of insidious creep of getting better. Once I've kind of got to that point where we start talking about breathing and moving and we know how to link things, I just say to them, right, this is the real basic stuff, breathing and moving as in walking. And then once we've nailed that, then I'll be like, okay, if you want to start to try and increase pace for a little bit, short interval, 20 seconds, pull it back, and then we slowly start to test the water without going mental with it. That's absolutely fine. And that's kind of how we do it. So we'll just gradually increase. And then you've got other people, and you have had Rachel on this podcast. And actually, the reason that she was having issues, number one, her breathing was poor. But number two, her thoughts and beliefs and all of that kind of side of it, which is very, very prevalent in long COVID, about, how you think about things and respond to things. Once she addressed that, she was actually able just to lift up the gates and go. And there wasn't any need to pace anymore. That was her scenario. So basically, they're the two extremes that I'm presenting you. And then there's everyone in between. Because, like you say, everyone's very, very different. And some people do need to pace. But if you are hyperventilating and post-exertional malaise and fatigue is coming from a perspective of the underlying physiology, you can rest all you like. You need to address that underlying issue, don't you? And then once you've done that, then we can start to move on. If that's not your underlying mechanism, something else is, then the parameters are going to be very, very different.
Definitely, yeah. That sort of fear of relapse almost makes you too scared to try anything sometimes. I certainly find I sort of think, well, I've had so many relapses that I don't want to do that because it's going to make it happen again. But you can't live the rest of your life like that.
No, you can't. But I completely understand it. But most people, what they tend to say is, oh, I did this and I was tired, but I rested for a couple of hours and then I was better. And once people sort of reach that point, then they're like, oh, I can deal with that. Like, that's an okay trade-off for me to be dealing with. But what people are not okay with is I walked 100 meters and I ended up bedbound for a month. Like, that's not an okay trade-off. So, people aren't going to push it there, and they shouldn't be. But those guys, once you really start to think, actually, my relapses are nowhere near as bad or as frequent now, then the confidence starts to build. And we've spoken about this before, but one of the biggest things that I end up trying to help people with is the fact that we need to rebuild confidence in their body again. So we start moving them forward in a really safe way. And everybody's safe is really different. So some people, if I'm like, oh, you're breathing really well, everything's normalized, like we're really moving in the right direction, do you want to go and do this? And they're like, yeah, I'm just going to go and do it. And they're like, yes, I did it, I feel really good, nothing happened. I'm like, yeah, awesome. And then other people are like, oh, I'm really anxious about doing that, and maybe I just kind of want to do this. I'm like, yeah, cool, do it, it's your time. Like, we don't then want to add a psychological issue to anything. So again, everyone's really different. We're human beings. What's the right thing to do for one person is definitely not the right thing to do for another.
Well, thank you so much for your time today. It's been absolutely fascinating, and there's loads of stuff that certainly will be helpful for me, and I'm sure for lots of other people. So thank you so much.
Brilliant. Thanks for having me again. It was really good to talk about breathing, as always.
Yeah. Thank you so much to all of my guests, and to you for listening. I hope you've enjoyed it, or at least found it useful. The Long COVID podcast is entirely self-produced and self-funded. I'm doing all of this myself. If you're able to, please go to buymeacoffee.com/longcovidpod to help me cover the costs of hosting the podcast. Please look out for the next episode of the Long COVID podcast. It's available on all the usual podcast hosting things. And do get in touch. I'd love to